Left of the box. And then here we have in Ontario, we've already started to divvy up, where a lot of our funding goes. So a lot of the funding meant for the public healthcare has been funneled away into private healthcare systems. So it's still public money going to support these private clinics. Oh, but people will still be able to get their services there. It's still publicly funded. So, you can still get your cataract surgeries and whatnot. It's just going to be done through a private clinic. But here's the thing about that. Wealthier Ontarians more likely to receive publicly funded cataract surgeries in private clinics, study says. Yeah, this is the two-tier healthcare system coming right at you, Ontario. New research finds that access to the surgery has increased since an Ontario government funding change, but only for one group. And this is the story of Mitchell Tremblay trying to get cataract surgery. He went to get it, and so then the Ford government announced that it would be addressing this wait list for the cataract surgeries, the most common surgery in this country, dedicating additional public funding for cataract surgeries performed in private for-profit clinics. As a high-risk patient, Tremblay was told his surgery had been fast-tracked to the Oakville branch of the Prism Eye Institute, a private clinic with 3 locations across the GTHA. However, Tremblay says his experience with Prism quickly turned sour as he found himself on the receiving end of an experience that advocates say have become increasingly common in private clinics across the province. He alleges he was upsold hundreds of dollars in uninsured services and suspects his surgery was delayed when he refused to pay. A new study adds weight to such suspicions. Analyzing 6 years of patient data, it found that a disproportionate number of surgeries performed by private clinics since the province's new funding allocation have gone to the wealthiest Ontarians. I can't say I'm shocked. Dr. Robert Campbell is an ophthalmologist at Queen's University and the chief author of a new study in the Canadian Medical Association Journal that analyzes the impact of the additional funding for cataract patients across the province. For years, those who did not want to wait for a cataract treatment in the public health system went to private clinics where patients could pay to get the surgery sooner. You can't actually charge patients for cataract surgery because of OHIP, says Campbell, but these clinics would have OHIP pay for the cataract surgeries and charge patients for other services in a way that would cover their costs and left a profit. During the pandemic emergency, when the province faced a growing wait list of these surgeries in public hospitals, the government stepped in to divert the patients in these clinics in an attempt to reduce the backlog. We want to see if this is working, Campbell says, because you would assume people from all socioeconomic strata would be able to access care at these centers, not just those who could pay extra. So that's what motivated us. Campbell and his team analyzed patient data from 2017 to 2022 and data from Statistics Canada to see how access to these surgeries has changed of 2020 when provincial government has first begun to subsidize them in private clinics. So what we did is divide the people into 5 different strata by socioeconomic status and compare their rates of surgery before and after the policy change, Campbell said. To put it bluntly, access did go up, but only for one group, and that was the group that could afford to pay extra. In fact, the team found that surgeries for those in the highest socioeconomic strata went up nearly 25% in private clinics. For those in the lowest, however, they fell by 8.5%. You see, that's the thing when you send our public funds to private clinics is that they're still a private clinic and they're still motivated by profit. And so even though these specific surgeries will still be publicly funded, the clinic will opt to have people to come in that can pay for the bells and whistles and make them money. And so if you can't pay for those bells and whistles, they'll put you aside in place of other people who can afford to pay for those bells and whistles. And meanwhile, the surgery that you desperately need keeps on being put off and off and off. this is a two-tier healthcare system already happening in this province. There should be a lot more outrage over this. But the thing is about this healthcare is that quite often people don't know enough to be outraged. You don't know it's a problem until it hits you. If there is nothing else my channel can do, the one thing I wanted to do is make people aware of what's happening to our healthcare system here in Canada. That is the primary thing. And I want people to know that this is an issue. I don't want people to find out the hard way when they need services. We have to fight 10 years just to get the healthcare we had 30 years ago. So for the next 10 years, we have to fight just to get it to what it was 30 years ago. And all these years where it should have been improving, the Liberals and the Conservatives have been chipping away at it to make it worse. Like pretty much ever since the NDP originally got it implemented, this universal health care of ours, it's been nonstop from the Liberals and Conservatives to chip it away to make it more like the Americans. And we see what happens down there, and no Canadian will say they want the American system. And yet they're sitting by and doing nothing while that's happening. So frustrating. So frustrating.